everyone, welcome back to my channel. Hope all of you are doing well and almost done with your KROK preparation. Those who still didn't started, no need to get involved in ministry book or basis. There is no time left to do that now. Just focus on the last 10-year papers, and for those who have done the last 10-year papers thoroughly, now just start doing the second attempt papers for at least last 2 years, so you will know that there is different level of first and the second attempt. They give some confusing concepts or change words in second attempt paper, although the second attempt papers has question from first attempt and also questions from previous year. But please do the second attempt papers also if you are done doing your last 10-year papers nicely. I am mentioning KROK 2020 last year second attempt paper with the answers. Look for it. Guys, I will put the PDF of KROK 1 2020 second attempt paper in my Facebook page. Download from there. If you are still unable to download it from there, you can see the video. I will read out the questions and answers. You can clearly see the questions there. Go for it. Okay guys, so question number 1. A 25-year-old woman complains of deteriorating vision. Examination revealed a defect in accommodation. The pupil is dilated and unresponsive to light. What muscles are functionally disturbed in this case? They have given you two problems, that there is defect in accommodation. So if you know which muscle is responsible for the accommodation in eyes, that is ciliary muscle. The second part is the pupil is dilated and unresponsive to light. So the situation is dilated, that means there is problem in sphincter muscle. They might rebuild this question by putting that pupil is constricted, not dilated. So the answer would be iris dilator muscle, but here they have given pupil is dilated and unresponsive to light. So answer would be iris, sphincter muscle and ciliary muscle, that is option number D. Okay. So question number 2. A dental student was hospitalized on day 3 after the onset of the disease. He was provisionally diagnosed with typhoid fever. What method of laboratory diagnostics allowing making a microbiological diagnosis? So first of all, day 3 and typhoid fever. So the answer is bacteriological. Question number 3. A 36-year-old man went mountain climbing on his vacation at the altitude of over 2000 meters above the sea level. He developed increased respiratory rate, tachycardia and slight dizziness. 2 days later, the signs returned to normal. This process is called, they are not asking you about any process or anything. It's a very common question that when you go to any situation where your the situations are not normal to your normal conditions, your body adapt. So the answer is adaptation. It's easy question. Question number 4. A person took a blocker drug which resulted in an increased heart rate when this person's eyeballs were pressed. Notice that increased heart rate. The expected eyeballs induced decrease in the heart rate did not occur. What exactly was blocked by this drug in the pacemaker cells? First of all, in this question, you should know that which receptors are present in the pacemaker cells, and the thing is you should know by blocking of which receptor cause increased heart rate. So the answer is D, muscarinic acetylcholine receptors. Next, question number 5. When examining a patient, the neurologist determined the absence of the knee jerk reflex that normally occurs when patellar tendon is being struck with reflex hammer. What nerve is likely to be damaged in this case? The question they are asking, the absence of knee jerk reflex and patellar tendon is being struck with reflex hammer. Knee jerk reflex, which nerves are given here? Gluteal, tibial, femoral, obturator, common fibular nerve. The answer is femoral nerve. Question number 6. During blood transfusion, it is recommended to transfer only the blood of corresponding group. In ABO system, the blood group is determined by. This is an easy question, guys. You all know how the blood group is determined. Carbohydrate determinants of erythrocytes membranes. Question number 7. Examination revealed that patient has problems with seeing color green. What cells are absent in the patient's retina? We all know that for dim light it's rod cells, for color vision it's cones. So the answer is neurosensory cells, cones. That is option number. Question number 8. A 30-year-old man has acute pancreatitis with disturbed extracellular digestion of proteins. This disturbance can be caused by insufficient synthesis and production of the following by the pancreas. So they are asking you that the patient has acute pancreatitis and the extracellular digestion of proteins is disturbed. So protein digestion disturbance is by trypsin. So the answer is C, trypsin. Question number 9. In chromosomal disorder, to study the karyotype, the cells cultured during mitosis is processed with colchicine. This substance blocks contractions of the fibers that forms mitotic spindle. At what stage will be mitosis interrupted? They are given that the cell culture during mitosis processed with colchicine. So the block is during the contraction of the fibers that forms mitotic spindle. So you should know in which stage of mitosis that spindles are formed. So the answer is metaphase. Number 10. A respiratory quotient was measured in a patient who for 10 days was keeping to a strict diet. The patient respiratory quotient is 1. What kind of diet was it? Guys, you should know respiratory quotients for carbohydrates, respiratory quotients for proteins. Usually I have seen questions with these two products are mainly given. They give you respiratory quotient or they ask you respiratory quotient. So for respiratory quotient 1, it is carbohydrate. So answer is A, mainly containing carbohydrates. So guys, for proteins, respiratory quotient is 0.8 and for fats 0.6. So they might ask you question by giving the respiratory quotient, and they will ask you which substance is in the diet, or they will give you the substance and they will ask you what is the respiratory quotient for this. So easy questions. Question number 11. Mother of a 12-year-old child came to a gastroenterologist, complains of loss of appetite and meteorism in her child. Endoscopy shows biliary dyskinesia. There are pear-shaped protozoa with 2 nuclei and multiple flagella in the duodenal content. What disease is most likely in this case? For this, guys, you should know the structural difference in these bacteria. Usually for diseases like this, like for typhoid, for cholera, like these diseases, questions are more on such diseases. So here they have given pear-shaped, 2 nuclei, multiple flagella. So pear-shaped protozoa with 2 nuclei is Lamblia. Guys, you might confuse between Balantiadis and Lambliasis, but remember that here they have given pear-shaped with 2 nuclei. Okay, in Balantiadis there is micro and macronuclei. They didn't mention that, and also the shape difference. Question number 12. A 12-year-old child has relatively short stature with disproportionate build and mental retardation. What hormone or hormones can cause this condition if underproduced? So with this question, guys, you will confuse between two options, that is growth hormones and thyroid hormones. When you will see short stature, you will go to growth hormone, but also read the question 2 times. You will see that disproportionate build and mental retardation. With growth hormone underproduced, there will be no mental retardation or disproportionate build. So in hypothyrosis, that means when there is unproduced or problem in thyroid hormones, you can see mental retardation and also disproportionate growth. Question number 13. In an experiment, a neuromuscular frog preparation was used to study single contraction of a muscle in response to electrostimulant of the nerve. How will muscle contraction change after the muscle is processed with a curare-like substance? Here you can see, guys, that they are asking you that how the muscle contraction gonna change when the muscle will be given curare-like substance. So you will see that the muscle contraction will disappear. These substances are muscle relaxants, and also a competitive inhibitor of acetylcholine. So when they are given, the stimulation is gonna disappear. Question number 14. When a skeleton muscle cell was exposed to electrical current, its membrane depolarized. What ions pass through the membrane, playing the main role in depolarization? In physiology first class, you have studied action potential. It's a very easy question for depolarization. Sodium ions, that is option A. Question number 15. Histological slide of the biopsy material obtained from epidermis of a healthy adult showing dividing cells in the basement layers. What process occurs due to these cells? They are asking you that histological slide of the biopsy material obtained from epidermis showing dividing cells in the basement layer. Dividing, so you can see that the regeneration is going on, so it's physiological regeneration. Question number 16. Section shows significant enlargement of the patient's right kidney. There is a nephrolith at the place of incision. Renal pelvic lumen is distended with accumulating urine. Renal parenchyma is substantially thinned out. What is the most correct diagnosis? In this question, you can easily see that they have given there is distended with accumulating urine. So the answer is hydronephrosis. Question number 17. Autopsy of the body of a 56-year-old man detected several ulcers from 4 to 5 cm in size. In terminal portion of the small intestine, there are numerous oval structures up to 5 cm in their longest part with surface that resembles cerebral cortex. Ulcer margins are raised above the mucosa while ulcer walls are covered in grey-yellow crumbling masses. Vidal test is positive. No need to get confused with this whole lot of question. The question is easy and the only thing you need to focus on is this last line, Vidal test is positive. If you know which test is given for which disease, like there are some particular special tests for some diseases, you can see these question in terminology which I mentioned in my last video. If you didn't watch the last video of my KROK 1 experience, go and check it out. There I have mentioned about the keywords. So Vidal test, it is for typhoid fever. So it's a very easy question. They just give you a long question to get you confused, but please focus on the main words, that is keywords. The typhoid fever for Vidal test. Okay. Question number 18. One of the cause of the pernicious anemia is disturbed synthesis of transcorine Cassell's intrinsic factor in the parietal cells of the stomach. What substance is called Cassell? Guys, please, as I told you, even if you are sure with your answer, either you read the question carefully at once, or if you are reading it fast, focus on it twice. They have first mentioned that synthesis of transcorine Cassell's intrinsic factor in the parietal cells. In the last line, they have answered what substance is called Cassell's extrinsic factor. So you should know the extrinsic factor, that is vitamin B12, cyanocobalamin or cobalamin as a short name. So option number C is the answer. Question number 19. When examining a biopsy material obtained from the thyroid gland, the pathologist discovered lymphocyte infiltration of the thyroid tissues and destruction of the parenchymal elements. Diffuse lymphocyte infiltration with lymphoid follicles was detected in the stroma. What is the most likely diagnosis? The question they have asked, the infiltration of the thyroid tissues and destruction of the parenchymal elements, and also diffuse lymphocyte infiltration with lymphoid follicles in the stroma. This you can see in Hashimoto's thyroiditis, that is chronic lymphocytic thyroiditis. So the answer is D. Question number 20. A 2-year-old child presents with marked delay in psychomotor development, vision and hearing deterioration, marked enlargement of the liver and spleen. The child diagnosed with hereditary Niemann-Pick disease with genetic defect is the cause of this disease. Also, it's a keyword question, guys. I told you that so many questions you will get from that keyword things, and again here it is Niemann-Pick disease. It's for sphingomyelin deficiency. So option number E. Question number 21. A 65-year-old woman with insulin-independent diabetes mellitus was prescribed glibenclamide to be taken orally. What is the mechanism of hypoglycemic action. So you should know that what is the function of glibenclamide, which cells to stimulate, and the mechanism. So I told you that pharmacology, pathophysiology and pathomorphology, these three subjects you need to focus more on, because you also have the weightage of these three subjects in KROK more. So the question here, it's because of pharmacology mechanism, and also you can study this in pathophysiology. So you should know glibenclamide acts. How does it act? So its mechanism is stimulates secretion of endogenous insulin by beta cells. So the answer is option number E. In pharmacology, guys, in pharmacology questions, either they give you the situation and ask for the drug of choice, either they give you contraindication, or they give you situation that this drug is given and this adverse effect is caused. So which drug we will give to the patient now? So in that case, you should know that which drug is the antagonist of that drug. So this also you will find in keyword papers, that this drug is antagonist to this drug. So many questions of pharmacology are like that. Question number 22. A cell with vitamin E deficiency was exposed to ionizing radiation. It resulted in intensified release of hydrolytic enzymes into the cytoplasm and a complete destruction of intracellular structures. Autolysis. What cell organelles caused this autolysis? Also, it's an easy question, guys. You studied in biology. That destruction, lysozymes. Option number B. Question number 23. Autopsy of the body revealed a large wedge-shaped patch of a dense mark red tissue with clear margins in the upper lobe of the right lung. Histological examination detected their necrosis of alveolar walls. The alveolar lumen is tightly packed with erythrocytes. What process occurred in lungs? Guys, wedge-shaped, you should remember in pathomorphology. This is because of infarction, and also they have mentioned erythrocytes, packed erythrocytes. So it's easily detected in the options. Hemorrhagic infarction. No other options are confusing. So it's easily you can know the answer. Question number 24. T lymphocytes were affected by HIV in the process. Viral enzyme reverse transcriptase RNA dependent DNA polymerase catalyzes the synthesis of. This question, guys, I have seen in so many papers. Either they confuse you by these options, RNA dependent DNA polymerase or DNA dependent RNA polymerase. So be clear with this question. They are asking you RNA dependent DNA polymerase. So you should know which is polymerizing. DNA is polymerizing. So what is gonna synthesize? DNA. So search for the option which has DNA. DNA. So DNA are given in three options. Here two options are matching. Viral DNA on the DNA matrix, no, because it's RNA dependent. The second option, DNA on the viral RNA matrix, this option is correct. D. Question number 25. A 2-year-old boy without immunization against measles was in a contact with measles patient. The doctor prescribed this child an immunoglobulin. What type of immunity forms after administration of immunoglobulin? The boy is 2-year-old. Okay. Then immunization against measles are given to the patient. So immunoglobulins, they are given antibodies directly. So first of all, that it's given from outside, so it will be artificial. Then it is immunization is given, not vaccination. If vaccination is there, then it will be artificial active. Okay. 26. The infectious diseases department received a patient with acute respiratory viral disease and body temperature of 39.5 degrees Celsius. What antibiotic drug should be prescribed in this case? I told you guys that pharmacology questions are like that. They give you disease, they ask for the drug. So acute respiratory viral disease and the temperature is also given. They easily asking you an antibiotic drug, that is Paracetamol, option number E. Question number 27. Myocardial histology shows a large area where there are no nuclei in cardiomyocytes and the cytoplasm is pink and homogeneous. On the periphery of the lesion, they are dilated. Acute pleiotropic vessels are marked. Infiltration with segmented leukocytes. This histological presentation indicates. Shows a large area, no nuclei in the cardiomyocytes, cytoplasm is pink and homogeneous on the periphery of the lesions. Periphery, guys, okay? Main focus on this periphery of the lesion, they are dilated, acutely pleiotropic vessels and marked infiltration with segmented leukocytes. Demarcation, inflammation around the infarction, okay? No nuclei in the cardiomyocyte and the cytoplasm is pink. There you can see because of infarction. Then they are given on the periphery, it's like this. So this caused demarcation. So the answer is C. That is demarcation, inflammation around the infarction. Question number 28. A laboratory received a sample of the patient's sputum. It is necessary to perform bacteriological tests for tuberculosis. What technique should the medical laboratory scientists use to stain the preparation for detection of the mycobacteria? This is a microbiology question. Also, you can find the answer by, if you have studied keywords, you can connect the questions by knowing the keywords. They are asking you that the patient has tuberculosis and the bacteriological test has to be done for tuberculosis. So for tuberculosis, Ziehl-Neelsen test is done. That is B. Question number 29. A 65-year-old woman who had been suffering from deep vein thrombophlebitis of the lower leg suddenly died when awaiting her appointment with the doctor. Autopsy revealed loose, fragile, red masses with corrugated dull surface in the main pulmonary artery and its bifurcation. What pathological process was discovered by the pathologist in the pulmonary artery? Guys, here you will see the option, like you might, after reading the question, you will see that there is thrombosis, there is embolism. So both option is correct, because here you can see first that thrombosis has occurred, but then you can also see in the question they have given that revealed loose, fragile, red masses. So when embolism is there, it goes from one place to another. So if we are seeing some fragile masses there, that means the embolism has also occurred. So the answer would be option number C, that is thromboembolism. If this line is not given that they have seen loose, fragile masses and anything like that, then the answer would be only thrombosis. Question number 30. A 5-year-old child was brought to admission room. The doctor determined the following signs: severe motor excitation, delirium and hoarse voice, dilated pupils, unresponsive to the light, hot and dry, hyperemic skin, tachycardia and tachypnea. These signs developed after the child had eaten belladonna berries. What pharmacological group of drugs should be prescribed in this case? Guys, they have given that the patient has severe motor excitation, dilated pupils, also unresponsive to light, tachycardia and tachypnea. So and also this is eaten by belladonna berries. So belladonna berries are poisonous because it may cause anticholinergic syndrome. All this which is given, delirium, excitation, this and all this, tachypnea, it is also known as anticholinergic syndrome. So anticholinergic syndrome is there, so we should given cholinergic drug. In this option we do not see any option like that, but there is, like, they are confusing you. It is indirect question, like option number C, anticholinesterase drugs, they have cholinergic effects. Okay, so option number C is correct. Anticholinesterase drugs are given for belladonna berries poisoning. Question number 31. A woman with menstrual disorder that includes prolonged bleeding presents with hypochromia, low reticulocytes counts, microcytosis and hypocydermia. What pathogenic group of anemia is it? They have given hypochromia. By this you will know, and also microcytosis. So hypochromic anemia, it is because of iron deficiency anemia. Iron deficiency anemia is hypochromic, and if there is given hyperchromic, then the answer would be vitamin B12 or vitamin B9. Question number 32. Inhibiting effect of GABA is based on increased permeability of postsynaptic membrane to chloride ions. This mediator forms in the result of decarboxylation. Guys, you should know that this hormones or this substance is made by which substance. You should know the precursors, because there are so many questions they ask you precursors. So the answer for this GABA, it is by glutamate. Decarboxylation of glutamate. Also they ask you mostly in allergy questions that which substance is formed and by decarboxylation of what substance. Question number 33. A patient is diagnosed with an acute necrotizing pancreatitis. What peritoneal cavity will be immediately exposed to exudate? They are asking you that acute necrotizing pancreatitis. So you should know that pancreas is present in which bursa. Anatomy is important, guys, but also if you know these basic things of anatomy, you can easily solve the questions. Like if you know mainly the positions, and also that syncope is important in anatomy. If you know the syncope, you can easily relate the questions. So they are asking you acute necrotizing pancreatitis. What peritoneal cavity is immediately exposed? Pancreas is bursa omentalis. So the infection or anything can directly go to bursa omentalis because it's nearby to pancreas. The question number 34. Histological slides of spleen and lymph node shows enlargement of lymphoid tissue, which can indicate activation of immune responses, wherein these organs can be found the zone of antigen independent proliferation and differentiation of B lymphocytes, B zone. So this is like germinal center of lymph node. Here you can see that antigen dependent proliferation and differentiation of B lymphocytes is occurring. Question number 35. A patient suffers from ischemic heart disease that disturbs energy supply to the myocardium. What process is the main source of energy for myocardium? Guys, they're asking you that main source of energy for myocardium. So the main source is fatty acid oxidation. Question number 36. Genealogical analysis of child with myotonic dystrophy determined that this disease manifests in every generation, is in equal measure present in the relatives of both genders. The risk of inheriting this disease is equal no matter which parent is affected. If one of the parent is heterozygous for the disease and the other parent is healthy, the risk of them giving birth to a sick child is 50%. What type of disease inheritance? After reading half of the question, you can easily find that it's a dominant disease, and then they have given that the disease, and you can see that the disease is present in both genders, so it is autosomal dominant. Easy question. Question number 37. A 67-year-old woman has gastric cancer with metastasis in the liver. What characteristics of tumor cells gives them the ability to metastasis? This you should know, guys. In so many papers they ask you about metastasis. Cancer questions are there in KROK papers. So metastasis, they are asking that what ability of the cells is there in metastasis. So metastasis is because of the infiltrative growth of the cells. They may lead to metastasis. Question number 38. 24 hours after an exam, the student's blood test shows leukocytosis without significant change in the leukogram. What mechanism of leukocytosis developed? Most likely in the peripheral blood in this case. Easy question, guys. This question I have found in 2-3 previous papers. So the answer is redistribution of leukocytes in the body because there is no significant change in the leukogram. Question number 39. Bacteriological study of feces inoculated on endomedium results in the growth of red colonies with metallic shine. They were agglutinated on a glass slide using a polyvalent serum against OK types of bacterial strains. How to determine the pathogenic variant of Colibacillus? Colibacillus, we have to find the pathogenic variant. So how we will find the pathogenic variant? Based on toxigenic characteristics, no. Based on morphological characteristics, no. Based on cultural characters, no. Based on its phase sensitivity, no. The option is D. Based on its antigenic characteristics. By knowing their antigenic characteristics, we will find the pathogenic cells because they are doing it with agglutinated on the glass slide. So this is by antigenic characteristic. Question number 40. A nurse was making an intramuscular injection into the posterior surface of the patient's shoulder. Suddenly the patient felt a severe pain in her shoulder muscles which spread to the posterior surface of the forearm. What nerve was damaged during the injection? Focus on posterior surface of the patient's shoulder. Suddenly the patient felt a severe pain in her shoulder muscles which spread to the posterior surface of the forearm. Also that it goes to the posterior surface of the forearm. What nerve was damaged due to injection? The answer is radial nerve. You might also think that the answer is axillary nerve, but focus on this word. The pain has gone to forearm. So the answer is radial nerve. Question number 41. Examination detected disturbed circulation in the patient's pancreas. What artery is likely to be damaged in this case? Disturbed in the circulation of pancreas. So for pancreas, what artery? Artery linealis. This vessel things you should know in anatomy, which vessel is connected to what and what branches are going with that artery. So you can easily find the answers. Question number 42. A 60-year-old man came to the doctor complaining of chest pain. In his blood serum there is a significant increase of enzyme activity, namely of aspartate aminotransferase, keratin phosphokinase and CPKMB isoenzyme. These changes indicate pathological process occurs in CPKMB. It's easy detection. It's in cardiac muscles. Answer is B. Question number 43. A woman presents with weight loss, exophthalmos, tachycardia, negative nitrogen balance, high blood glucose and high blood levels of free fatty acids. What dysfunction can be characterized by such changes? So you will see that exophthalmos, it's because of hyperthyroidism, when there is increase in thyroid enzymes. So the answer is A, hyperthyroidism. To treat the burns, a patient was prescribed a drug with antiseptic properties that are based on formation of atomic oxygen in the presence of organic substance. This drug has also an astringent anti-inflammatory effect due to formation of albuminates. Name these drugs. They are asking you anti-inflammatory drug and also it's in antiseptic, and also they have, it's easy question, they have mentioned that also formation of atomic oxygen. So atomic oxygen formation is by potassium permanganate. Even guys, if you skip one subject and you know other subjects, you can find this answer. Like if you don't know pharmacology, this anti-inflammatory things and all that, but if you know chemistry, you can easily find the answer of this question. So just you should focus on relating the concepts. Like if you don't know the answer of that question, just don't skip it. Try to find the answer by adding or mixing your concepts which you know and connecting the questions and the options. One more thing, if you don't know, like if the question is confusing to you, go to the options and see that which options you can eliminate. Like there are options which do not connect to the questions at all. So when you eliminate the options, you can see that there are like 2 or maybe 3 you can find. Usually you will find 2 options that are most correct, so it will be easy for you to choose one option out of 2 rather than choosing 1 out of 4. So question number 45. A 5-year-old child is diagnosed with Bruton's disease, X-linked a gamma globulinemia that manifests itself in severe clinical course of bacterial infections and absence of B lymphocytes and plasma cells. What changes of immunoglobulin content can be observed in the blood serum of the child with immunodeficiency? In X-linked A gamma globulinemia, you will see decreased IgA and IgM. Easy question. Answer is A. Question number 46. During a surgery on the thoracic spine, the surgeon severed the ligaments that connect the vertebral arches. What ligament were severed by the surgeon? So you can see options: ligament intertransversa, ligament supraspinal, ligament fava, ligament longitudinal posterior, ligament interspinalis. So focus that surgery on the thoracic spine and the ligament that connects the vertebral arches. So the ligament that connect the vertebral arches is ligament flava. Also you know, also it is called the yellow ligament. Question number 47. One more thing guys, you should know the other names also. Like in anatomy, this ligament is known as this. Also commonly it's known as this, and also in diseases that this disease is this, but commonly the disease is known with this name. So focus on the other names also, because in 2020 paper pharmacology questions, the other names of the drugs has came which we cannot connect. We are having problems in connecting the names because we only know one name of that drug and they have given the other name or the common name of those drugs in the options. Question number 47. Autopsy of the body of a 67-year-old man shows acutely swollen and dull rectosigmoid mucosa in his large intestine. The mucosa there has multiple erosions and ulcers as well as single polyps. Histologically, the mucosa has acute infiltrations consisting of lymphocytes, plasma cells, neutrophilic granulocytes and eosinophils, which are located mainly in the lumina of crypts abscesses. The intestinal wall is sclerotic and there are proliferations of granulation tissue that form polyps. What is the most likely diagnosis? Swollen rectosigmoid mucosa. You will know that the problem is in intestine. So we can see that all these things we can easily see in which diseases. So you will know exacerbation of ulcerative colitis, no, because nothing they have given you like and non-specific or anything you can't find in the question. Acute ulcerative colitis, no. Crohn's disease, no. Typhoid fever, it cannot be because they didn't give anything about typhoid. Dysentery is the right answer because in dysentery you can see all these problems like multiple erosions, mucosa and mucosa containing all these cells. So the most correct answer is dysentery. Question number 48. A 30-year-old man complains of abdominal pain and diarrhea that persists for 5 days already, chills and fever 37.5 degrees Celsius. The day before he was in forest where he was drinking from an open body of water. Bacterological confirmed the diagnosis of amoebic dysentery. What is the drug of choice for the treatment of this condition? This question on this drug are most common guys. You will find metronidazole questions of pharmacology in so many papers. So please study this drug nicely. Metronidazole for amoebic dysentery. Question number 49. Blood test of the patient revealed albumin content of 20 gram per liter and increased activity of lactate dehydrogenase isoenzyme 5 LDH5. This results in indicate order of the following organ. There are two types of question of this. They will give you LDH2, LDH3, or they will give you LDH5. So if it is LDH5, then the answer is liver. If it is LDH2, the answer would be heart. So please focus on this question and know for LDH number which organ is there. Question number 50. Examination shows that the patient apical beat is displaced 3.5 cm to the left from the left mid-clavicular line. What heart chambers are likely to be hypertrophic in this case? One more thing, guys, please focus on the position of the heart according to the mid-clavicular lines, and also know its syncope. Okay, so here it's given that the apical beat is displaced 3.5 cm to the left from the mid-clavicular line, to the left. So this displacement is because of the hypertrophy of, easily we can see in the option left. Two options are left atrium and left ventricle. So the answer is left ventricle because it's in the apical position.